Do you feel like you're constantly running to the bathroom? Or get such a strong urge to go that you sometimes don't make it in time? Maybe you're waking up throughout the night just to pee. If this sounds familiar, you might be dealing with overactive bladder. Today, let's talk about what that really means, why it happens, and what you can do about it. Overactive bladder usually shows up in a few key ways. You might notice you're going more than 8 times a day, and if it's starting to interrupt your daily life, that's a problem. You might also feel sudden, intense urges to go that you just can't delay, and for some people this leads to leakage or accidents. Waking up more than once a night to urinate is another sign. These symptoms can seem small at first, but together they can have a huge impact on how you live your life. This isn't just about inconvenience. Constant bathroom trips can make it hard to work or enjoy social activities. Some people start avoiding going out altogether, planning their whole day around where the nearest bathroom is. The financial side can be stressful too: pads, special underwear, bedding, it all adds up. It can even affect intimacy if you're worried about leakage during sex. Overactive bladder is far more common than most people realize, affecting around 16% of the population. There are many reasons this can happen. Age plays a role, although that doesn't mean the symptoms are something you just have to accept. Being overweight can also increase the chances of leakage or urgency. Pregnancy, vaginal deliveries, and certain medical conditions, like diabetes, depression, multiple sclerosis, Parkinson's, spinal cord injuries, or a history of stroke, can contribute as well. Surgeries in the pelvic area, such as hysterectomy or procedures for stress incontinence, can create changes that lead to symptoms. Even recurring urinary tract infections or medications like water pills can make things worse. When you visit a urologist, they'll start by asking about your symptoms: how often you go, what bothers you most, whether you've had leakage, and how long this has been going on. They'll review your medical history, perform an exam, and check for things like an enlarged prostate in men or cysts around the urethra. Your urine will be tested to rule out infection or blood, and they may do a quick ultrasound after you urinate to see how well your bladder is emptying. There's also a helpful overactive bladder guide available for free, which walks you through recognizing symptoms and learning how to manage them, whether for yourself or someone you care for. Now let's talk about treatment. The good news is that there are many options. One simple starting point is weight loss. Research shows that losing even about 8% of your body weight can noticeably improve bladder symptoms. Paying attention to bladder irritants can help too. Some common triggers include alcohol, caffeine, spicy or acidic foods, carbonated drinks, and artificial sweeteners. You don't need to cut everything at once. Try removing one item for a few days and see if anything changes. Balancing your fluid intake is also important. Drinking too much makes you go more. Drinking too little makes your urine more concentrated, which can irritate your bladder. A good rule is to drink with meals and sip water slowly throughout the day, rather than taking big gulps. Keeping constipation under control is another key step, since a full rectum presses on the bladder and increases urgency. And if you smoke, quitting can make a huge difference, both for your bladder and your overall health. Pelvic floor physical therapy can be incredibly helpful. A therapist can teach you techniques to control urges, such as using quick pelvic contractions to let that intense wave of urgency pass before you calmly head to the bathroom. It's important to be evaluated first, so you know you're doing the right exercises for your body. If lifestyle changes aren't enough, there are effective medications that can help relax the bladder or reduce unwanted contractions. Beyond medication, there are advanced treatments like bladder pacemakers, which send gentle signals to calm the bladder muscles, or bladder Botox, which can reduce symptoms for 6 to 9 months at a time. Another treatment, tibial nerve stimulation, works by stimulating a nerve near the ankle to influence bladder function, with many people seeing significant improvement. There's even a newer implantable device that provides this stimulation automatically at home. The most important thing to know is that you don't have to live with these symptoms. There are many treatments available, and a urologist can help find the right combination for you. You deserve to feel comfortable, confident, and in control of your body, because you're worth it.